The first thing to figure out when you're planning for Medicare is when to enroll. And there are two parts to that enrollment process. The first is enrolling with the government into Original Medicare Part A and Part B. That's the baseline. And then once that is done, and that's done through the Social Security Administration, once that's done, then you can enroll in the private insurance option of your choice. So either a Medicare supplement or Medigap plan or Medicare Advantage, and a Part D plan if you buy that with a Medicare supplement plan. So turning our focus back to the government enrollment, the question you need to ask is, do I get health insurance from a large employer? And is that from active employment? So the large employer, the bar there is 20 or more employees, not employees enrolled in their health plan, just 20 employees who work at the company or are in the group. If you or your spouse gets health insurance from that source and you are on that health insurance, then you can delay Medicare enrollment until you or your spouse retires, or you decide to drop it, or you can enroll in Medicare right at age 65. It's your choice. If you don't have health insurance from a large employer, so you're self-employed, you've got an ACA or Obamacare plan, you're on retiree medical, you are on COBRA, something like that, then you need to enroll in Medicare at age 65. So if you need to enroll at 65 or you choose to, then you need to pay attention to what's called your initial enrollment period, or IEP. It is a 7-month window around your 65th birthday. It's in the middle of that 7-month window. So basically, you can enroll as early as 3 months before your 65th birthday, which is what I encourage everyone to do. Get it done early. You have technically until 3 months after your 65th birthday to enroll without being late, but it's rarely a good idea to do that. Get it done in those 1, 2, 3 months before your 65th birthday so that everything has time to be processed and so you've got ID cards in hand ready to go at the earliest opportunity. If you enroll on the early end, like I suggest, then your coverage is going to start at the earliest opportunity, which is the first of your 65th birth month. So the example I like to give is you were born sometime in July, say July 4th, then your coverage would start on July 1st at the earliest, and you could enroll and get all that done as early as April of that year. So there's one exception to this, is if you happen to be born on the first of the month, you just slide the timeline back by 1 month. So your IEP starts 4 months before your birthday and it ends 2 months after, and your earliest start date is the first of the month before your 65th birthday. So you're born in July, on July 1st, your IEP starts in March, ends in September, and the earliest your Medicare would start is June. So let's say you are still working. By the way, you're going to enroll in Part A and Part B if you want to jump fully to Medicare at 65. And the application will ask if you want both parts. You'll say yes to it. If you are delaying Medicare enrollment because you're allowed to, then a couple things you can do. You can either drop the group coverage, the employer coverage, and go to Medicare. And you might do that if Medicare is a better deal for you, if the benefits are better. Usually if someone is fighting a serious illness, Medicare is going to cover things. If you configure it right, it's going to cover things a lot better than an employer plan. So that would make a lot of sense. But some people just decide to delay, and that's totally fine if you're in that situation. Again, it's got to be from active employment. You or your spouse, however you get that insurance, can't be on leave, can't be retired, can't be COBRA coverage. It has to be from active employment. So let's say you're in this position. If you decide to delay, you can either enroll in just Part A because, hey, it can't hurt. It's probably free to you, and it'll become secondary coverage while you're still on the group plan. It'll rarely kick in, but nice to have, and you get half the enrollment steps done. Perfect. Or if you have an HSA or health savings account and you want to keep contributing to it, you hold off on the entire thing until the group coverage goes away. Because if you are enrolled in any part of Medicare, either A or B, you can't contribute to a health savings account anymore. So be aware of that. And if you are doing that, you need to stop contributions at least 6 months before enrolling in any part of Medicare. That's to avoid any tax issues with those contributions. So you can either enroll in Part A at 65 and then wait for Part B and the rest of it until retirement, or you can delay all of it until retirement if you're going to delay at all. If you miss your enrollment period, and I should say, if in that situation, if you are delaying, then that is called a special enrollment period. So you'll use that instead of your IEP or initial enrollment period. And as far as timing goes, if you're going to delay, as soon as you know what the end date of the employer or group coverage is, then you need to get all your papers in order, all your ducks in a row, and be ready to get the enrollment done as early as 3 months before the end date. They won't process it if it's any earlier than that, but you want to get it in 3 months, because I have seen it take 3 months for the late enrollment situation like this to be processed. And we'll go into the details of that in the next video on the guide, but that's an important thing to point out. Technically, you have 8 months after the group coverage ends to enroll during your special enrollment period, but I've never seen a situation where it makes sense to wait. Get it done beforehand so that it starts the day after your group coverage ends. All right, so if you miss any of these enrollment periods, there is a catch-all period called the general enrollment period that is every year from January 1st through March 31st. So you're going to have to wait until then to enroll, and you're going to have a late enrollment penalty, which is going to be permanent. But if you're watching this video, if you're looking at my guide here, you're not going to risk having to do this, but just so you're aware. And then last note, I've touched on this a couple times in this video, but COBRA does not count as employer coverage. It is not an excuse to delay Medicare enrollment. It's very important, and a lot of people make this mistake, probably because an outgoing employer is offering to subsidize or completely pay for COBRA coverage for someone who's retiring. I've seen that, and they say, hey, that's a good deal, I'll take them up on it. And what they don't realize is COBRA coverage is, if you're Medicare eligible, so 65 or older, then COBRA is going to be secondary health insurance. It's going to expect Medicare to be the primary health insurance, whether you're enrolled in Medicare or not. So if you don't enroll in Medicare, just think COBRA is going to be okay, and then worry about Medicare after that, then you're going to be going through that COBRA period without primary health insurance and not even know it. And you're going to be on the hook for medical expenses. So I've yet to meet a person who would be comfortable with that. So COBRA, not an excuse to delay Medicare.